The Asthma and Allergy Foundation of America. Today is World Asthma Day, and we're here in the nation's capital with our colleagues from the American Academy of Allergy, Asthma, and Immunology, and my colleagues from AFA, Dr. Mitch Grayson, who heads up our Medical Scientific Council, and Jenna Riemenschneider, who heads up our policy area. You know, today is World Asthma Day, and what we've seen is cuts to the National Asthma Control Program, which is housed at the CDC, threatened cuts to Medicaid, and research funding at the NIH. The National Asthma Control Program is only a $33 million program that funds state-based asthma programs, and over the life of it, it's reduced mortality by close to 45%. And it's a terrific return on investment because every dollar spent in the National Asthma Control Program yields $71 in reduced healthcare costs, reduced missed work days, reduced school days, missed school days in children. So it's really important that a program that small continues, and we're here to advocate for that. Medicaid is another important issue for us. For children who have asthma, 50% of them are on Medicaid or CHIPS. And it's the number one reason or a top reason for missed school days. And certainly reductions in NIH funding will impact food allergy research, asthma research, cutting edge technologies and research that we've been so famous for as a country in America. So with that, I want to turn it over to Dr. Williams to introduce himself and his colleagues, and then maybe we'll go to some Q&A.
Hi, I'm Paul Williams. I'm immediate past president of the American Academy of Allergy, Asthma, and Immunology. Our academy has 7,000 members, most of whom are physicians either doing research or practice and taking care of patients with asthma and allergy. And we're all about increasing the knowledge to improve the practice. I echo what Kenny said about these drastic cuts or proposed cuts to budgets that are really going to adversely impact our ability as physicians to care for these patients. And I have colleagues with me today on World Asthma Day and in the Asthma and Allergy Awareness Month. We're visiting with their elected representatives and senators to talk to them about reducing the NIH budget, Medicare payments, Medicaid cuts, and NIH and CDC adverse funding recommendations. So let me introduce my colleagues. First, to my immediate right is Shahab Farani, who is a practicing allergist in the DC area. And next to him is Allison Freeman, who's a practicing allergist in Virginia. Shahab.
Thank you, Paul.
Hi.
Hi.
So we're so happy to be here with Quad AI today. I'm Jenna Riemenschneider with the Asthma and Allergy Foundation of America. I'm going to ask you guys a few questions to get your perspective as practicing allergists.
Yeah,
so,
we'd love that.
First up, why is Medicaid essential for asthma patients?
Yeah, I think this is a great question, and I think it really relates personally with our practice. So I practice in Fredericksburg, which is about 50 miles from the capital, and we have a pretty diverse population, both with our federal employees, plus a huge Medicaid population. And this makes a meaningful difference when we see actual cuts to care, ultimately. When you don't have care, you don't have access, the rates of you going to an urgent care or an emergency room is going to go up. And that's just going to be not beneficial for the patient, their family, and overall everybody, because we all share the burden of that cost. And like Kenny had mentioned, 8 of 10 of children who are on Medicaid are covered by Medicaid, which is a pretty substantial amount of that population.
Astounding number.
Yeah, right? Also half of adults. So like if we're playing a numbers game, this is a huge dynamic change. If this is cut, we're going to see more and more impact where these people will have to seek care, and the only guaranteed care in America is in an emergency room at this point.
So what I'm hearing is cuts are not savings.
They are not.
Awesome.
Yeah.
All right. Dr. Freeman, are you concerned about potential research cuts, particularly in the food allergy space?
I absolutely am. Food allergy is something I do in my practice every day, and I have benefited from being able to read the research that the NIH has sponsored on food allergy for the last 2 decades. That has led to amazing improvements in the early diagnosis and early treatment of infants with their first food allergy symptoms. And we can change the trajectory for those kids. They don't have to grow up living in fear of eating. we can fix it early. But I wouldn't know how to do that without those NIH-sponsored trials that COFAR did. So I need that to continue so I can provide early interruption in the food allergy path.
Amazing. So we're protecting research dollars, which brings me to Mitch. Dr. Grayson, what message? Oh, no, sorry. Can you share how NIH funding directly supports your asthma and allergy practice and your care to patients?
Sure. So I think we have to remember a couple of things. So first of all, NIH actually helps support me do research on the mechanisms of the development of asthma and how asthma occurs in patients, as well as how to properly treat asthma. And we need to remember where our treatments came from. And we've heard a little bit about this from the Consortium for Food Allergy Research, but also for asthma. The medicines that we use today to treat patients with asthma, with food allergy, with any of these diseases came out of studies that were funded by the NIH. There was an asthma net back 10, 15 years ago. That's what led to most of these biologics that we have. Plus, before that, there was basic science research that led to finding the actual targets for which we have these new drugs that we're using now. The Consortium for Food Allergy Research, which taught us how we should be introducing foods, the use of other biologics for the treatment of foods. All of these things came out of funding from the NIH. Without that money, without those studies, we would still be treating people the way we were treating people 30 or 40 years ago. We wouldn't actually be able to be at the point where we can make people that have food allergies be able to tolerate their foods. We wouldn't be at the point where most people with asthma should not have any symptoms of asthma if they're treated properly. That's what we're going to lose if we don't support NIH funding.
It's an incredibly powerful message. Speaking of messages, we're here on Capitol Hill. What message do you want Congress to hear today on World Asthma Day?
So we're here on World Asthma Day. Every day in the United States, 10 people die of asthma. I think that's something that's a terrible statistic for us to know. Well, not terrible statistic. No, it's an important statistic. No, it's a terrible statistic to exist. 10 people every day. Most of those are preventable. What I want Congress to hear is that if we don't fund research, if we don't fund Medicaid, that number is not going to go down. That number is going to go up. I would hate to be here a year from now and say that 100 people die every day of asthma. You can make a difference. You need to fund the research and you need to fund the medical care. We can treat people. Nobody should be dying of asthma every day in America. And we can do that if you do your job. Not you, Jenna, Congress.
I will also try to do my job. Well, thank you so much. I think, we're all here today because we're here for the patients, and we're here to build awareness in Congress, protect the programs that are essential to care in the United States, particularly for children. And again, thank you all for being here today, and I'll pass it back to Kenny.
Great, thanks, Jenna. Thanks, Mitch and doctors. I mean, I have asthma myself, and so this is personal to me. My kids and family have asthma as well. But I think we've heard here how just a small investment can yield great results. And I know that there is a theme of chronic health and trying to address concerns around chronic health by the current administration. And there's nothing that's more prevalent than something like asthma as a chronic health condition and allergies. And I know people's allergies are feeling a lot worse because the allergy seasons are getting longer and more intense. What a lot of people don't realize is that there's something called allergic asthma, and that can trigger asthma. And so all these things are related. So it's really important to have the investment here. It's a tiny investment for a great return of not only saving lives, but saving the $82 billion that asthma costs the healthcare system and society. We can make a difference here. We don't need to be spending money on needless care as long as we have the care up front and the investment in research and the medical programs that we've got today. So that's my message. Anything else from anyone?
Happy World Asthma Day.
Yeah.
Oh, thank you, Kenny, for those words. Again, speaking from a standpoint of people who actually care for asthma and allergy patients in the office, we don't want to go back to the way we were doing it 20 or 30 years ago. We want to continue to develop personalized treatment plans for our patients, and NIH funding allows us to do that.
Great.
Happy World Asthma Day.
Happy World Asthma Day.
Asthma Day.
Hi, I'm Andy Spears with AFA, and we just want to remind you can follow us live all day as we visit members of Congress and ask for funding for NACP.
Right. Thank you, Andy.